Well, good morning. We're speaking with Tad Fisher, the CEO of the FPTA, who's going to give us an update on our FPTA efforts to modernize the Practice Act.
Good morning. Thank you, Liz.
So would you first fill us in on the process that is going through for the subcommittees?
Well, first of all, it's Senate Bill 450, which was sponsored by Senator Denise Grimsely from Sebring, and House Bill 107, which is sponsored by Travis Cummings from the Orange Park area. And these two legislators have been very involved with physical therapy and Florida Physical Therapy Association for a number of years, and agreed to sponsor our legislation after last year. They were original sponsors and came back and said they'd be willing to do it again. Second of all, we've worked the legislation with opposing interests, Florida Medical Association, Florida Orthopedic Society, and a few others, and have found compromise. And the issues that are contained in the bill deal with our first steps of modernizing the Physical Therapy Practice Act. And so what we hope is once we pass this legislation in 2016, it'll lead to additional changes and modernization of the Practice Act, really freeing up physical therapists to practice to the full extent of their education and training. Mm-hmm. What these bills do currently is they change the direct access for a patient from the current limitation of 21 days to 30 days. So a physical therapist can continue to treat beyond the 21-day barrier that's in place now for an additional 9 days. Then, of course, they would have to refer the patient to a physician or other healthcare provider as defined inside the Practice Act for the review of the care plan. The additional part of it, which we're very excited about, is it removes the limitation that's in place for out-of-state referrals. So when the snowbirds and other visitors come to Florida, they've had an injury or an accident or a disease that they're dealing with and they need physical therapy, they're going to be able to continue to see a physical therapist in Florida without interruption, as long as the physical therapist is treating that patient for the original diagnosis that the referral came in on. So that's a very exciting change, I know, for many of our members and practitioners in the state, because that interruption in care obviously breaks continuity, but it's important for the patient to continue to have the good care that they're getting from their physical therapist so that they improve and the outcomes improve and they get better all along the way. The final component to that legislation is we begin to codify into law the definition of doctor of physical therapy. We protect the title of physical therapist and doctor of physical therapist so that you're using PT, DPT appropriately in your title as you speak to the public or identify yourself as a healthcare provider in the state of Florida.
Okay, thank you.